order it if necessary. No. The question is, as on the order paper, Sir Christopher Chope.
Madam Deputy Speaker, as we've just witnessed, feelings run very strongly on this issue, and there are large numbers of people who have suffered directly or indirectly as a result of having COVID-19 vaccines. That doesn't mean to say that for most people, the vast majority, COVID-19 vaccines were very good news, and they made an enormous contribution to the public health of this country. But that doesn't mean to say that we should turn a blind eye to those people for whom the vaccines were bad news. And in the earlier debate today, I reiterated my request of the government that they should take effective action under the Vaccine Damage Payment Scheme to ensure that those people for whom the vaccines were bad news receive their proper compensation. As the honourable gentleman who introduced this debate reminded us, the maximum payment under that scheme is £120,000. It hasn't been updated in line with inflation since 2007, which means that it's the equivalent of about £200,000 if it had been updated. Why doesn't the government update it? There are relatively small numbers of people involved in that, but it seems as though there's a reluctance on the part of the government to face up to the reality that for a small proportion of people, the vaccines were bad news. And we started off, when we had this debate initially, soon after the rollout of the vaccines, the government was unequivocal in saying that these vaccines were safe and effective, and there was no qualification in respect of that at all. Subsequently, we had AstraZeneca issuing a notice, essentially a warning notice to practitioners that they should be cautious about the rollout of some of the vaccines to some patients. And we've now reached a situation in which the people who may wish to make their claims against the vaccine manufacturers and or the government, civil claims to supplement the £120,000 which they've already been awarded, those people are now finding it very difficult to get access to lawyers to pursue their claims, particularly if those claims arise from vaccines which were administered after AstraZeneca issued their first warning against the safety of their vaccines in certain circumstances. And we have a situation now where there are a large number of people across the country who are looking to the government to intervene, first of all, to ensure that the Vaccine Damage Payment Scheme is updated. Secondly, to ensure that the people who've applied under that scheme have their claims dealt with in a reasonable time frame, and many of them are not. The more than 9,000 claims, and 4,000 plus haven't even been resolved yet. And the delays are extending to 18 months or more. The consequence for many of those claimants is that they are unable to begin their civil actions, but the civil actions have to be brought within 3 years of the cause of action arising if they're not going to be affected by the limitation period. And I've asked the Prime Minister, I had a meeting with him and raised it also at Prime Minister's questions, whether the government will intervene to ensure that those people who are still waiting a determination in relation to the outcome of their claims under the Vaccine Damage Payment Scheme, whether, if they then wish to go on and sue the government or the manufacturers, whether the government will ensure that the 3-year limitation period does not apply in their cases. It's a matter, in my view, of simple equity and justice. But I've yet to have a substantive answer from the government. I'm due to meet the Secretary of State for Health next week, and I hope that by then she will be able to assure me, she's a lawyer as well as being Secretary of State for Health, she will be able to assure me that nobody is going to be denied justice as a result of the delays by the government in administering the vaccine damage payments scheme. I share very much the disappointment of the honourable member who introduced this debate that Module 4 of the public inquiry has been postponed. Back, I think, last August, Madam Deputy Speaker, there was a preliminary hearing and there was some very potent advocacy by the lawyers representing the groups who, the victim groups who wanted to give evidence in Module 4, and that evidence, I think, will be extremely compelling when it is heard by the inquiry. And it was a big disappointment to those groups and to me and to others that Module 4 was postponed. And we've been told it's been postponed until January next year. The reasons for that postponement seem to me to be rather weak and feeble, but the inquiry is independent, and so what was to have been a period of evidence being given in July is now not going to be heard until January next year. The implications of that are serious for those people who are seeking compensation for their suffering, but it's also very significant for that other group of people, because the Module 4 deals not just with vaccines, but it also deals with therapeutics. And there's a big issue about therapeutics, Madam Deputy Speaker, because Evershed, which was the therapeutic which was thought to be available and should have been available to those, particularly those immunosuppressed who were not able to take the vaccines, that Evershed was never approved by NICE, and then a second version of Evershed has been brought forward, and that still has not been approved by NICE. And one of my constituents, Bernard Mathis, has written to me within the last month, drawing to my attention a letter sent by a group of charities concerned with this issue to the Prime Minister on the 26th of March, calling for the government to intervene and ensure that there's an early decision made on what can be done to help the immunocompromised people who are not able to get access to the vaccines in any event. And my constituent says France has given emergency authorisation to Evershed 2 and has got it into patients within a month of authorisation, and he believes that other European countries are going to do the same. The United States has given another drug, Permgada, emergency authorisation, and so on. And why is it that we can't get a commitment from the government to ensure that Evershed is available to those people who are clinically vulnerable at the moment? And as my constituent says, he wrote to me in July 2023 expressing the need for a fast track, an essential pre-exposure prophylaxis drug. And the consequence for him is that he and his wife have been effectively shielding for about 4 years. They only meet friends outside. They don't travel on public transport or go by aeroplane. They ask the family to test before they come to see them. They mask indoors and have to assess every situation to gauge the risks involved, which means obviously that they have a much restricted and isolated life to their detriment. And that could be resolved if this issue over Evershed was taken seriously by the government. And if Module 4 had been heard this summer, then maybe Baroness Hallett, as an interim recommendation, would have been able to say the government's got to get on with that. Of course I will.
I'm enjoying my Rushmore friend's speech hugely. I too have a constituent who is immunosuppressed and who is unbelievably still shielding, which is putting huge pressure on the family. And doesn't the slowness of the decision over this therapeutic stand in sorry contrast with the rapid decision taken on the vaccines in the first place?
Exactly, and I think one of the inhibitions that there may have been on the part of the government was that, in order to justify the use of emergency vaccines, it was necessary for the government to believe in itself that there was no alternative. And of course, if these alternative measures had been recognised as being a suitable way of providing some protection to individuals against COVID-19, then that would have undermined the case that the vaccine manufacturers are putting forward, that they needed to have emergency authorisation for their vaccines without them going through the normal testing procedures. And so the continuing slowness, tardity of the government in responding to the requests for the licensing of Evershield just reinforce the feeling out there that amongst a lot of people that there's something funny going on here, and that actually if we'd come forward with these therapeutic measures at the beginning, it would have saved lots of lives. It would have reduced the need for the vaccination programme to be so extensive, and it would also have saved the government a lot of money. There is an issue there, but that's why I think the part of this motion which regrets the postponement of this element of the COVID-19 inquiry is very important.